Hello and welcome. I'm Dr. Tagari with Avalon Laser. Today we're going to be discussing a more unique application of Botox that's being done more frequently for women who are looking to prevent wrinkles before they start. In addition to the Botox that we usually do for women of all ages, we're finding that women of even younger ages are coming to us to have their wrinkles treated before they even start. In addition to using Botox in this manner, we use Botox for axillary hyperhidrosis, which is the application of Botox in the underarm to treat excessive sweating. However, we're finding that for Botox for cosmetic purposes, women are coming to us to prevent the wrinkles before they become noticeable and before they have to be treated by other means. Now, Jenna has graciously allowed us to demonstrate this application on her, and we're going to use her since she has excellent skin to help her prevent the wrinkles before they start. So, welcome, Jenna.
Thank you.
Wonderful. So, Jenna, go ahead and show everyone by scrunching forward what we've got to deal with here. So, as you can see, in the glabella area, which is the fancy term for the area between the eyebrows, Jenna has some areas where we can see in the future she could develop some problems. Now, she's got some strong muscles here, and we're going to be treating these muscles with a higher concentration of Botox. And Botox in this manner is used very frequently to treat these wrinkles. So, you ready?
Ready.
Wonderful. Now, at Avalon Laser, what we like to do for greater patient comfort is we like to treat with a triple anesthetic topical cream. This cream has already been put on for Jenna, so she's already ready to go. And we prep the skin with alcohol before we start to prevent the risk of infection. By applying this cream about 5 to 10 minutes before the application of Botox, we find that patients find this a lot more comfortable, and they generally tolerate the procedure much better. So, one thing we're going to do, which is frequently done, to help guide us, is we're going to find the areas in which we're most likely to want to go. So if you don't mind scratching for me one more time, Jenna. So I'll make a small mark with this magic marker, and we'll treat the central area first, and here, and here as well. So this is going to be the muscle which is going to be inactivated by application of the Botox. One thing that's important to realize is that you never want to inject through the ink marks because you run the risk of creating a permanent tattoo effect in that area. So, we start with our Botox. What we use is a short half-inch 30-gauge needle, which we find is much easier to control and also has less dead space within the needle. Longer needles have the tendency to buckle, and you have a little bit less control over the application. So, what we'll start is we'll start on the bottom. So, one more time, scratch from it. So dab a little bit here. And I'll pull the skin taut, and we'll inject into the belly of the muscle. And what we'll gently do is inject 0.1 cc's. And we'll come back out. At this concentration, we're using 4 units per 0.1 cc. The area. And Jenna doesn't really bleed very much at all, which is very good. And we'll treat the opposite side. So we'll pull the skin taut, and again we'll go adjacent to the ink mark. Come back out. And one more time, we're going to go scrunch from adjacent to the ink mark. And we'll come back out. With this application of Botox, we're finding that you don't really need to use as much as you do when you're using Botox for therapeutic purposes. Not only do women require lower amounts of Botox, but younger women for whom this is being used as preventive maintenance are actually people that you don't want to use too much for. The reason for that is you don't want to create an artificial tightening of the skin where people lose expression, and it becomes an unpleasant experience for them when they walk out and can't use their normal expressions. So by using a modest amount, in this case, each injection of 0.1 cc's is 4 units of Botox. What we've done is given her a modest amount of Botox, and then what we can do at the next visit is layer the effect so it becomes more natural, so when people are seen out and about, it looks more natural for them as well. And that way people don't know that something was done for the client, which they find a lot more pleasant. So, how'd you feel?
Not too bad.
Wonderful.
Yeah.
What we're going to do for you afterwards is simply clean the skin with some alcohol. The alcohol works as an astringent, which is just a fancy way of saying it's going to help the small capillaries that could cause small red dots to occur to constrict. The other benefit of the alcohol is it removes the ink that we used as our guidance. This will also help remove the triple anesthetic cream. And Jenna may have some small red dots, but with the higher application of the Botox, the higher concentration of the Botox, what we find is a smaller amount of fluid is injected, which means that it's absorbed much more quickly. And what we find is this helps people go about their business much more quickly with less downtime and less need for makeup to cover up the area that was treated. So, one more time, with the alcohol. How do you feel?
Great.
And we're done. And that's basically it. Come visit us at www.avalon-laser.com and you can find a lot more of our applications there.